welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and in today's video, we're going to be discussing two common types of leg ulcers. So venous leg ulcers and arterial leg ulcers. Although both are chronic wounds that cause significant pain and discomfort, they have distinct causes, symptoms, and treatment approaches. So understanding these differences is critical for effective management and healing. So let's start with venous leg ulcers. So these are the most common type of leg ulcers, accounting for about 80% of leg ulcers. They're typically caused by poor circulation in the veins, often due to venous insufficiency. In this condition, the veins have trouble sending blood back to the heart, leading to blood pooling in the lower legs and feet. Damaged or weakened vein valves can cause the blood to flow backwards, causing increased pressure in the veins, a condition known as venous hypertension. This increased pressure can eventually lead to the development of venous ulcers, typically around the lower leg and ankle area. Venous ulcers are usually shallow with a red base and a thick yellowish drainage. They're often surrounded by discolored skin tissue due to poor circulation. On the other hand, arterial leg ulcers are less common, but much more serious. These ulcers are caused by insufficient blood flow due to the narrowing or blocked arteries, typically due to a condition where plaque builds up in the arteries and restricts blood flow. Unlike venous leg ulcers, arterial ulcers form because the tissues are deprived of oxygen and nutrients due to poor arterial circulation. This is often result in ischemia or oxygen-starved tissue, which leads to the ulceration, typically on the toes, feet, lower parts of the leg, or shin. Arterial ulcers tend to be deeper than venous leg ulcers with well-defined edges and a pale, possibly black base due to tissue death. They are often painful, especially when the leg is elevated due to the lack of blood flow. Now let's compare venous and arterial leg ulcers side by side. So location. Venous ulcers typically occur around the lower leg, often near the ankle, whereas arterial ulcers are often found on the feet, toes, or shin. Their appearance, so venous ulcers are usually shallow with an irregular edge and a yellow or greenish wound base, while arterial ulcers are deeper with that well-defined edges and that pale or necrotic base. Venous ulcers tend to be less painful, except when they're infected, while arterial ulcers are often quite painful, especially when the legs are elevated, and this is due to the reduced blood flow. Venous ulcers produce a lot of drainage, often thick and yellow, while arterial ulcers are on the drier side and don't produce as much exudate or drainage. The symptoms of both types of ulcers differ, and understanding these can help with diagnosis and treatment. For venous leg ulcers, the symptoms may include swelling of the legs, especially around the ankle, dark discolored skin around the ulcer area, itching, heaviness, or a feeling of tightness around the lower legs, and a presence of varicose veins. Now, as for arterial leg ulcers, the symptoms may include cold feet or legs, a weakened or absent pulse in the feet or legs, hair loss on the legs, pale or even bluish skin, especially in the affected area. Pain in the leg or feet, especially at night or when the feet are elevated. Now, risk factors for both conditions, they often overlap. So for venous ulcers, risk factors include a history of deep vein thrombosis, obesity, pregnancy, and prolonged standing. For arterial ulcers, common risk factors include smoking, diabetes, high cholesterol, and a history of heart disease. Diagnosing the type of leg ulcer is critical to effective treatment. Healthcare professionals use several methods to differentiate between venous leg ulcers and arterial ulcers. So, for example, a Doppler ultrasound or ankle brachial index can assess blood flow in the arteries, helping to diagnose arterial ulcers. Treatment for venous leg ulcers typically focus on improving circulation and managing the wound. So this may include compression therapy to reduce swelling and promote blood flow back to the heart, moist wound healing with appropriate dressings, leg elevation to reduce swelling, and surgical interventions if necessary to address underlying venous insufficiency. Now, treatment for arterial ulcers are focused on restoring blood flow to the affected area. So this may include revascularization surgery to open up the blocked arteries, antiplatelet therapy to improve circulation, wound care with dry dressing and regular debridement, and lifestyle changes, which include to stop smoking and to manage underlying conditions such as diabetes. While both venous and arterial leg ulcers are serious conditions, understanding the differences is key to providing the right care. Whether you're managing a wound at home or working with a healthcare professional, the proper diagnosis and treatment plan are essential for effective wound healing. I want to thank you so much for watching this video, and I hope it did clearly explain the differences between a venous leg ulcer and arterial ulcer, and you understand why it's so important that we need to diagnose what it is, because treatment plans are so different. But that's all I have for this video, guys, and I hope to catch you in my next one. Bye for now. Don't forget to visit my website, thewoundconsultant.com, for all your wound care needs. Whether you're seeking professional wound care consultations, digital resources, informative books, or high-quality wound care supplies, we have everything to support you. Whether you're dealing with a wound or you're a healthcare professional, there's something for everyone.